Hello, I'm Dr. Anagha Vaze from Nexus Eye Care, and we have Professor Gerald Liew here with us, who is our retinal specialist, and he's going to talk to us about few of the macular pathologies, particularly concentrating on macular degeneration, which is one of the commonest macular pathologies that we come across in any retinal practice. So welcome, Professor Liew. To begin with, can you tell me what is macular degeneration?
Thank you, Anagha. It's a pleasure to be here. Macular degeneration is a condition that affects the back of the eye. It happens to many of us as we get older. It usually starts out as early macular degeneration, where little yellow spots appear at the back of the eyes. Over time, these can develop to become late macular degeneration, and that is comprised mainly of wet macular degeneration or dry macular degeneration, or a combination of both. In wet macular degeneration, an abnormal blood vessel grows into the back of the eye, and this can bleed and leak, causing loss of vision. In dry macular degeneration, patches at the back of the eye stop working, and as these enlarge, they can also cause loss of vision.
Often patients come to us telling us, "Doctor, I've got macula." So doesn't macula mean a normal anatomical portion of the eye? I don't know if they're confusing it with macular degeneration. Is that right?
Yes, quite right. Yes, it's probably some patients are using the term as a short form, interchangeable for macular degeneration, and the technical term is age-related macular degeneration. Quite a mouthful, so probably they've shortened it. But it does point out, though, that this is the reason why the condition is such a problem, because the macula is something that all of us have, and it refers to the center of the vision. And if that part of the eye is affected, then vision is quite severely affected.
Actually, that was exactly what I was going to ask you. How will I know if I have macular degeneration? Like, what would be the symptoms? What will I experience? And how quickly should I see someone like you, like a retinal specialist?
That's a very good question, and a very important one as well. Unfortunately, the only way to know for sure if you have macular degeneration is to see either an eye specialist like us, or to see an optometrist, someone who makes glasses. So what happens is, this eye health professional will put drops into your eyes, look into the back of the eyes, take photographs and scan the eyes. And that will help determine if macular degeneration is present, what sort it is, and how bad it is. Now, in terms of symptoms, unfortunately, macular degeneration is often not symptomatic until the late stages. So many people with early macular degeneration are not aware that they have it. Once it causes symptoms, the main symptoms, which are caused a blurry patch, can suddenly appear in the center of your vision, particularly while reading. Problems with reading, such as letters getting jumbled up or moving around, and distortion, whereby straight lines look distorted, curved, or bendy. If any of these things happen, it's important to get your eyes checked as soon as possible, certainly within a few days if that's possible.
Okay, is there a way we can monitor this at home? Because this might not necessarily happen when we are in a doctor's office. So is there a way that the patients can monitor this at home so that it can be detected early and have early access to treatment?
Again, a very important question, because the sooner this is picked up and the sooner it can be treated, the better the outcomes. One way that this can be monitored at home is with what's called an Amsler grid. And this is a grid pattern that's given to patients, and you can check your eyes one at a time. And if you notice, it helps you pick up distortion. Another way is just by looking around. For example, many patients describe while driving, suddenly the road divider becomes wavy, or curves appear on straight lines like doorways, or if you do a lot of work on the computer, on Excel spreadsheets. If any of these symptoms occur, it's important to check which eye it's involving and to get your eyes checked out as soon as possible.
So it sounds like, macular degeneration really can cause central visual loss and central blindness. So how is it treated? How can we treat it?
Yeah, it's very important too. Early macular degeneration usually doesn't need any treatment other than close monitoring. Late macular degeneration does, and fortunately, for wet macular degeneration, there is a very effective treatment. It involves injections into the eye of a medicine called an anti-vascular endothelial growth factor agent, or an anti-VEGF agent. There are several types, and your doctor, your eye specialist, will be able to tell you what's the best one for you. These injections, it will shrink the abnormal blood vessel and stop the bleeding and the swelling and leakage. They're highly effective in most patients. For dry macular degeneration, unfortunately, there remain no proven treatments in Australia, but in the United States, there is a new treatment that seems to be quite effective. Hopefully, over the next few years, it'll become available in Australia.
Okay, the treatment for wet macular degeneration in the form of injections really seems quite good in stopping the patients from, developing central visual loss. But it sounds a bit, tricky when you tell the patients that you're going to need injections into the eye. So are these injections or these treatments, are they painful? Do they need to be done in an operating room, or can they be done in a procedure room in the doctor's surgery? How does it work?
Absolutely. And this is a situation where the thought of it is often worse than the reality. I can assure you that the injections, they don't hurt and you don't see the needle. And especially the way we do it here at Nexus Eye Care, lots of anesthetic is delivered to the eye to numb the eye fully so you don't feel the needle. And we approach from the side so you don't see the needle. The procedure is safe. The rate of complications is very, very low. It does need to be given quite regularly though, but most patients need it more frequently in the beginning, and after a while, once the macular degeneration comes under control, an injection once every 2 or 3 months is sufficient for most patients.
That sounds excellent. Having said that, though, I always wondered if I develop macular degeneration, I'm always scared of going blind. So will I go blind if I develop macular degeneration?
Yes, I guess that really goes to the crux of it. Thankfully, the answer is, in the vast majority of patients, you will not go blind, provided you continue to receive the injections. We have many patients here who have continued to be able to read, to drive, and to live independently well into their 80s and even 90s. It is important, though, to continue with the injections because if you stop suddenly, the macular degeneration can relapse. You can have a reactivation. And that can lead to permanent damage, which is very difficult to treat. I might go back to a question you asked as to where to give the injections. Well, that depends, but most injections can be delivered very safely, quickly, and effectively in the clinic. And we find that works well for most patients.
Excellent. So basically, trying to get the patient's best visual outcomes with least number of injections is the way to go forward for wet macular degeneration. But, you just mentioned about not having, currently there are no proven treatments to treat dry macular degeneration. But how quickly does dry macular degeneration progress to an advanced stage? And is it a concern that we don't have treatments for that at the moment?
Well, fortunately, dry macular degeneration is very slowly progressive. It often takes years to decades before it becomes a problem.
Can we do anything to avoid developing macular degeneration? Is there anything, are there any environmental risk factors and, anything basically that we can do to prevent it from getting it or slowing the progression?
Fortunately, there are things that can be done to slow progression and to reduce the chances of getting it. The most important would be to have a healthy diet rich in leafy green vegetables. Having fish 2 to 3 times a week helps as well. And certainly stop smoking if you do smoke. If you find it difficult to have green vegetables or fish, there are supplements that you can take. These can be discussed with an optometrist or with your eye specialist.